Thanks for joining us at Conversations and Connections for part 2 of our series spotlighting women leaders in Canadian lung cancer. Today, we continue our conversation with Dr. Rosalyn Juergens and Dr. Michela Febbraro, two trailblazing medical oncologists making waves in Canadian lung cancer care, research, and advocacy. If you missed part 1, go back and check it out. We discussed their personal career journeys, what inspired their focus in lung cancer, and they highlighted strong leaders and the innovative work being done to transform the landscape of oncology care in Canada. In this episode, we talk about the importance of creating community and fostering supportive networks, how mentorship shaped their career paths and played a key role in building networks within the lung cancer community. They shared advice for those considering a career in oncology, as well as where we can learn more to get involved. As we wrap up 2025, we wanted to thank you, our listeners, for making the time in your day to be part of our community. A shout out to HBA's talented podcast team, who volunteers their time to bring these conversations to you. Finally, our thanks to Ogilvy Health for supporting HBA this year. When healthcare impact is your goal, let Ogilvy Health be your partner. Now, let's get back into it and learn more about these incredible leaders making an impact in oncology in Canada. Look, let's go to one of at HBA mentorship, and is such a big thing in our world. One of our pillars and our goals are helping develop women leaders for life. And so, behind every great leader, there's typically someone who has offered guidance or opened a door. And obviously you two share a meaningful mentor-mentee relationship, which love to hear more about that. And maybe even just mentorship overall in either the lung community or in your careers. Who are some of the most influential mentors and how have they shaped you? I think, Michela, you have very clearly mentioned Roz has been that for you. Is there anyone else other than the folks that you've mentioned that you think have either made you think a different way or helped you become who you are?
Yeah, I think if I had to think through, there's been a few, and they've all been female, which has been really, really great. There's a lot of male mentors as well, but just highlighting the females. Dr. Christine Brejden-Maisley is a breast and GI medical oncologist out of Toronto, who I was exposed to when I was a medical student, and she was just this powerhouse of a female as well, who had a very unique way of talking to her patients and really kind of getting down to their level and supporting them. But then also meeting me where I was at. I think I was a second or third year medical student, and for somebody like her to take the time that she did to mentor me and to continue. She actually does a mentorship, leads a mentorship program with Christine Simmons out of BC that I was lucky enough to take a part of this year. It's called the Jump Mentorship Program, which was such an empowering week. We were out in Newfoundland this year for 4 days, and it was just a program that focused on mentoring you as a new to practice physician, not when it comes to the medical aspect of things, but how can you be a leader, how can you be an advocate, how can you be a strong female voice in the medical oncology community without letting imposter syndrome take over. And so that it was a very unique experience. So I would say Dr. Brejden is another female mentor that really paved the way for me. And I would be remiss, I know that it's the elephant in the room, at least amongst the three of us, I would be remiss if I didn't say my mom as well. So my mother, Dr. Spadafora, is a medical oncologist out of Sault Ste. Marie. I get to work with her. I think if you think through her mentorship, it was mothering me over the last few decades. But I appreciated the fact that throughout my medical training, she was always a mom first, and Roz has mentioned that with her children. When I started doing some volunteer work at the hospital and I'd come to visit her, she said to me, you should consider calling me Dr. Spatafora in the hospital. I'm like, but you've always been my mom, and mom will always trump physician. And so the compromise was Dr. Mom, and that's what I called her in the hospital if I ever crossed paths with her. But she really supported me from the personal side of things. It wasn't like I was coming home at the end of my clinic day and she was asking me, well, what cool things did you see? It was more, did you eat? Have you done your laundry? How are you feeling? Is there anything that's weighing on you that you need to talk through? And so I wouldn't be the person that I am today if it wasn't for her. So that would be the other mentor.
If you didn't mention her, I was gonna, because she is, both Dr. Basley and your mom are forces to be reckoned with, but your mom loves you fiercely, and it is apparent in any conversation you have with her, you and your siblings. So thank you for sharing that. Roz, do you have any that you'd like to add on?
Well, so, I've had the good fortune, again, of having opportunities. A shout out to Dr. Karen Kelly. She's the current CEO of the International Association for the Study of Lung Cancer. It's the international organization that binds us all together. She and I met, again, early days at a meeting called the Targeted Therapy and Lung Cancer meeting, and then would meet at different women in oncology events. And she has always been kind and a mentor. And then I look when I came here to Canada, and again, I didn't know a soul. And so, grateful for Dr. Peter Ellis, who's one of my colleagues in Hamilton, who put me out there and gave me opportunities, first in the Ontario space, and then Dr. Barb Malosky out in BC, and again, Natasha Lale in Toronto, both just incredible friends and colleagues. I want to give a shout out to a partner in crime of mine, Dr. Desiree Howe. So Des and I met because we co-led a clinical trial through the Investigational New Drug Committee at CCTG. And again, thanks to Dr. Leslie Seymour, who has tirelessly led the Investigational New Drug Committee at CCTG for many, many, many years. So Des and I found ourselves in a position where we were leading a trial together, and we were just going through such similar things, again, kids and research and trying to figure out how to balance it all. And we found a space where we could congratulate and commiserate. But I need to give a shout out to Des. She's the former president of the Canadian Association for Medical Oncology. And one of the things that she did during her presidency in that organization is to set up a mentorship program. And I do believe there's somebody who is involved in that program as well. That would be Dr. Febbraro. But we realize that this is a community that needs support. The job that we do is not an easy one, right? And having people who can, we talk about different levels of how you support people, and there's direct mentors, right? That those people that you work with on a day-to-day that you will reach out to and run a patient case by, or talk about a difficult scenario or whatever it might be. And those are mentors, colleagues, etc. But then there's this also concept called sponsorship. So when you start to find yourself moving forward, I say, I've gotten to where I've gotten, and I still am surprised that I get to where I have been. Because, like I said, all I've done is I consider myself, I've just done my day job. And like I said, the universe has aligned to allow me to have the privilege to get to do some of the different things that I do. My job now is to pay it forward. And so I try very hard to make sure that people have an opportunity to get recognized. I have a wonderful young physician. Her name's Dr. Courtney Koski, who's been working with me. She's a new faculty member here at Hamilton. And it is so amazing to get to see her blossom in her career. I literally spend hours writing letters of mentorship and support for folks, nominating people for awards and things like that, because I will tell you that is one shortcoming often of women. We're really good at getting our tasks done and meeting all of those different obligations. But one thing that we are not very good at is promoting ourselves. Women take longer to put themselves up for promotion. Like if you look at my institution alone, a colleague of mine who is another force for supporting women, Dr. Bindi Desi. She's a breast and GI medical oncologist, huge force in education. She and I became full professors at McMaster in oncology last year, and we're the first women clinicians to ever get that title. No women had ever gone through the paces before. And so sometimes it's that little reminder of how great you are, right? And I try to do that as often as I can when people introduce themselves and I'm like, oh, okay, well, let's actually talk about the wonderful things that this person has done that you guys might not know about. And I can do that and shout from the rafters about how great people are, but people are often not so good about doing that for themselves. And so, you need mentors, but you also need sponsors in life. And, I look at that and like I said, I've been so privileged to have folks who have been out there who have said, hey, I know this doctor, I think she would be great at this. And so, putting that name forward. And that's one of the fun things that I get to do now is I'm like, hey, yeah, I could give that talk, but actually, I want to hear from this young, bright mind. So why don't we invite this person to speak so that we get to see how different people interpret different things. And I think that that's an important part of working our way through the system is paying it forward because somebody has done that for me in the past. And that's how I've gotten to where I've gotten. And I want to see that same opportunity for the next person coming behind.
I love that mentality. There need to be more. You two are precious gems. There need to be more people like you in the world. The lung cancer community for sure has many incredible folks, as does oncology and overall. One thing that came to mind was Wink C. Am I pronouncing that properly?
Yeah.
Are either of you connected with that? I know. I think Dr. Spadafora at one point, she and I had collaborated on a few things in that area, and they seem to be they are very impressive as well. So are either of you involved in that?
So Winkelink or
Winkelink, yeah.
Yeah, Winkelink. So Women in Cancer and All in Cancer is a wonderful organization. And not to highlight Roz, but she actually won the mentorship award last year for Winkelink.
Didn't know that. That's great. Highlight away.
Yeah, so she won the award last year. Myself and a few of my other colleagues, Dr. Courtney Kashi was also one of them, who nominated her for the award last year because when we thought through who in our journey has impacted us, the two of us were just like, well, it was Roz. And so we wanted to show her how much her mentorship and sponsorship has meant for us. But Winkelink is a wonderful organization. They're actually going to be doing an educational session, I think, highlighting rural and remote health in oncology coming up in November, affiliated with the Canadian Association of Medical Oncology annual general meeting. So their next event is next month. So
I saw that on the calendar. I saw that on the agenda. Okay, look, we only got a couple more questions left, a handful. Okay, so you've been very generous with your time and attention, and you're super engaging. I love it for a Friday morning this early. It's great. So, mentorship and community are often really thought to go hand in hand by most or by many, and building community is so important, clearly, in the lung cancer space. And I know for Lung Cancer Canada, that is all over any of your communications. So wondering if either of you would want to comment on what does a strong, inclusive lung cancer community look like to you? And are we there? Have we achieved it?
Yeah. So, it's tricky because, again, we've recognized now, lung cancer is a myriad of diseases, and, no one effort will represent every single person with lung cancer. And so that's work that we're doing, right? Is, we're trying to battle the concept of stigma, right? We did a campaign in partnership with the Lung Health Foundation, really just trying to reframe, if you encounter someone who's been diagnosed with lung cancer, the first question shouldn't be, did you smoke? Or people shouldn't feel like they have to justify or defend. The first question you ask should be, what can I do to help you? No different than anything else. And especially with that stigma, people are often afraid to reach out and ask for support and ask for help. And so that's been an important part of that the lung cancer community has been trying to create a safe space for that. And I will say, there's been incredible patient advocacy that's been out there, right? There's groups like Lung Cancer Canada, but then some of these different individual subtypes also have support elements. So we've got the EGFR resistors, the ALK positives, the KRAS kickers. There are all sorts of the ROS wonders. I so wish that was me, but there's a type of lung cancer.
I was going to say, is that you? Real? Is that exist?
ROS1 translocated lung cancer.
Oh, wow.
And so, social media has its warts, but one thing it has brought together is people can now find other people who look like them. And so it is broken down the barriers that a global disease like lung cancer has and allows people to talk about lived experience. And I think that's an incredible thing to bind people together. And the efforts continue to develop drugs in all aspects of lung cancer. The highlight for me for 2025 is we're finally making a dent in a type of lung cancer called small cell lung cancer. So small cell lung cancer was really the first type of lung cancer. They used to call it oat cell cancer because it looked like little oats when they looked at it under the microscope. We're talking 1900 type timeframes. And it was one of the first spaces where we recognized that chemotherapy could be impactful, but it's an awful diagnosis. These people end up very, very sick at the beginning, and many of our patients honestly show up in hospital. They're so unwell when they first are diagnosed. So it's been very difficult to move the needle. And literally over 30 years, the only thing that has really changed with regards to the management had been different ways that we had incorporated radiation. We looked at integrating immunotherapy, which is a wonderful novel treatment that we use across multiple different aspects of lung cancer, and it moved the bar a little bit. But we have now all of a sudden seen looking at immunotherapy in other spaces, we had, wonderful plenary outcomes of using immunotherapy after chemotherapy and radiation for those who have locally advanced small cell. And then just incredible benefits of novel treatments where we're trying to engage the immune system in a different way. There are these things called bispecific T-cell engagers. Small cell is an interesting cancer in that it's what we call a bit of an immune desert where the immune system just does not see it. And so there are these novel treatments that actually bind the immune system and the cancer cells together so that you can't help but see it if you shove it in their face. And we've used this in late lines of cancer. And I honestly teased at the beginning that this was only going to be for, very unique, unicorn, alicorn type patients. But now we're seeing it's safe to do as outpatient. It's safe to do even in frontline in combination with the other treatments we have. And so we're seeing treatments that are really making meaningful impacts. And so, we continue to spread our efforts, right? If we look at, we're now moving the needle in small cell. We've made improvements in mesothelioma and understanding that disease. And then now all the different subtypes, we're up to about a dozen subtypes of lung cancer. And that's been one of the things that we've had to sort out is lung cancer may be common, but when you have to break it down into all these little itty bitty subgroups, there may be 100 Canadians affected by this one little subtype of lung cancer. How do you get drug development in that space? How do you get drugs through an approval process that was designed back when we would do 1,000 patient clinical trials where you would randomize people to one treatment or another. And so, the world is starting to move forward. And, that's been efforts of advocacy in general is how do we work with our government partners to make sure that we're using respectful healthcare dollars, but also trying to make sure that Canada stays on par with other sister countries. And so lots of work to be done.
Well, yes, it's access to innovation is so important, and we could talk for hours on that. I know, the three of us, over wine or coffee. But look, we're as we're gonna start our wrap up. Let's sort of look into the future, okay? And Michela, this one's for you. What advice would you give to young women, or anyone really, but young women in particular, considering an oncology field, especially those who might want to focus in lung?
Yeah, I think oncology is a really unique opportunity. You get a chance to be a part of somebody's journey at a time where there's a lot of fear, there's a lot of emotion, there may be some anger, some anxiety and stress, and you get to come into their lives and help support them through the journey. One of the things that I say about cancer is I don't control the outcome. My success or my determination and success is how did that person experience their cancer? How did their family experience their cancer? Because if that journey as a whole, regardless of whether or not somebody was cured or unfortunately they fell victim to their cancer, regardless of that outcome, if their journey was positive, if their journey was safe, if their journey was met with treatment that they wouldn't have gotten access to otherwise, then that's a success in my view. And so there's a lot of beauty to be a part of that journey for somebody. And so if somebody out there is considering a career in oncology, I would say take it, because it is exciting. No day is the same. And you get to meet some incredible people, men and women, who will help to allow your career to grow, and you'll get to be that person for somebody else in the future. So that's my piece of advice, is just do it.
Look, I try to make a habit. I haven't cried yet on this podcast, okay? I have not. I have 6 or 7 or 8 under my belt so far. I did cry after the last one we recorded, but the camera was off. So that one's coming in the new year. Wait for that one. It's going to be awesome. But I will say what you just said about seeing people along their journey. As a caregiver of 2 parents who experienced cancer, wow, there need to be more of you in the world. So I wish that's an impressive perspective. So if you could have a magic wand, Roz, okay? If you could have a magic wand, and, what's one thing that you would love to see? I'm sure there are many, especially in your current roles that you play. What would you love to see of the landscape of lung cancer changing within the next 5 years?
So first, we need to have screening across the board. I'm so proud of some of my Canadian colleagues who have made such global impacts. It has been incredible to watch some of the improvements that we see. And I've got colleagues out in BC and colleagues in Toronto who really have done incredible things in screening and trying to figure out how do we expand the criteria, et cetera. And they're now doing additional work in what does this look like if we screen never smokers or people who are otherwise at high risk and smoking isn't the risk factor. So I would love to see a world in which we have access to screening, so we find more and more lung cancers in an early stage rather than a late stage. I keep saying I would love to put myself out of business, right? Like if we could catch more lung cancers, and I will find something else to do. Let me tell you, right? I can put my skills to other places. But if we could diagnose more lung cancers early, I think it'll be impactful. The other thing I think that is going to change the way that we practice is some of these minimally invasive detection methodologies. So I'm talking about something called circulating tumor DNA. So that's been work that many of us have put efforts into, and I do think that that will, in my career, change how we think about managing patients with lung cancer, whether it's helping us to decide who after a surgery needs further therapy. We're in a brave new world where all of a sudden we now have stage 4 lung cancer patients, and they can get 2 years of immunotherapy and then go into a quasi state of remission. And it's a weird space, right? Because their CAT scans don't necessarily look normal, but even without treatment, they continue to thrive and do well. I'm going to be speaking at the Best of Lung Cancer on this idea of long-term survivorship in some of these spaces. And we're going to have to figure out, how do we continue to serve these folks? And I could see a world in which, a CAT scan may not be as good as something like circulating tumor DNA to help us sort whether or not we need to re-challenge somebody with treatment, et cetera. We're now in a world where I'm on a steering committee for an educational activity, again, stage 4 lung cancer patients, but on survivorship. So one other proud lung cancer moment, there's a subtype of lung cancer called ALK-positive lung cancer, and there's a treatment that's available now, and we've now seen from an ESMO presentation with earlier generations of drugs where the median survival is now 8 to 10 years, and we've got new treatments now that are 3rd generation drugs where over half of the patients are still on that first treatment 5 years later. We used to talk to people about their amount of time in months, and now all of a sudden we're looking at you might be on this first line therapy for over 5 years. And people aren't used to thinking about lung cancer patients hanging out with us for this long. And so this educational activity I'm doing is about, how do we optimize people's physical health? How do we optimize people's mental health? How do we make sure that we continue to focus on whole person care? Because I will tell you, it's a travesty when you've got somebody who's doing incredibly well with their lung cancer and they have a heart attack, not related to their cancer treatment, but because they weren't keeping up with all the things that all of us should do as we get older, like getting their blood pressure checked or getting their cholesterol checked and managing some of these modifiable risk factors. So we need to remember back to those roots of whole person care of, how do we look after not just the cancer, but their overall physical health, their overall mental health, because those are important aspects of what we do. And so as I think about, where do we go in the next 5 years, it's going to be on the backs of screening, robust testing, minimally invasive access to things like circulating tumor DNA, and then continuing to make sure that we have available optimal targeted therapies, whether that target is a tyrosine kinase inhibitor for a specific driver mutant lung cancer, whether that's targeted therapy in the world of immunotherapy and pairing the right immune-based treatment for people. That's what's moved the bar thus far in lung cancer, right? And we're finally seeing that we've jumped about 10% in the overall 5-year survival of lung cancer on the most recent iteration. But that number is still too low. Like we're at 25%. That's woeful in comparison to breast and colon cancer, et cetera. And really those next big leaps are going to become on early detection and getting those folks identified in an early phase. And Canada is poised to continue to make maneuvers to make this the reality.
Look, you should go for politics. I would vote for you in a heartbeat. Go after it. Okay, finally, last question. I believe you. I'm sold. Like, really. Okay, so for our listeners who want to make a difference but don't know how, what are some of the ways that you think people can support advocacy efforts or get involved with Lung Cancer Canada?
Well, that's easy, right? Come to our website. we have opportunities for folks to volunteer. One thing I want to give a shout out to is we actually now have a national walk for lung cancer. It's called the Give a Breath Walk. It started out in Alberta. A wonderful gentleman named Tim Mons started this. And Tim has now made this a national effort. So not only do they walk in Edmonton, we walk in multiple places across this country. And the money raised goes to help support all sorts of things, but Lung Cancer Canada is one of them. And we're actually expanding into, research grants and things like that through that. So it's not only supporting the patient-facing efforts, but also trying to do what we can to help support those people who are invested in improving lung cancer care. So the smallest thing you could do is it's every June. I think it's usually the first weekend in June. Get out and walk with lung cancer. And I always used to say that was one of the hardships with lung cancer, and why I felt it was so important to become a lung cancer advocate is so many of my patients didn't have a voice, right? They were so overwhelmed with their diagnosis that having bandwidth to go out and march around and bring attention to this disease was lacking. But now we actually are making inroads, and we have survivors. And so they too want to march and bring acknowledgement to lung cancer in this country. So please support the Give a Breath 5K run walk that will happen in June. Like I said, we also have patient support efforts across this country. So if you're interested in us bringing a summit to your local area, this is something that we do with supports of local physicians. And we do educational nights in local jurisdictions. Michela did one up in Sault Ste. Marie. I've done one in Hamilton. We've had them literally across the country. And Lung Cancer Canada will help support, and it's an opportunity to bring other people in your community together to learn more about lung cancer and aspects that are of interest. And we tailor them all to whatever the local community is interested in learning about. And we try to find speakers, whether they're local speakers or if they don't have the right person, then we'll that's the beauty of technology. We'll video in somebody to try to provide that lift. We've had everything from psychologists to nutritionists to some of our exercise folks, to people talking about novel treatments or talking about screening. So lots of ways to improve educational efforts. So don't hesitate to reach out. No, there's no small bit of advocacy, right? And I go back to what I said at the beginning of this, that many hands make light work, and that's the beauty of the lung cancer community. Is I've yet to meet somebody who isn't willing to extend a hand to help support. And that is the fantastic aspect of this. Is it is all welcoming.
Any last thoughts, Michela?
No, I don't think you can.
You're good. I know you've done such a great job. You've done such a great job considering you just got back from being away overseas, and it's early in the morning, and I think you're really spry, and you've done such a great job for our conversation. One thing I have been tuning into, Lung Cancer Canada has this policy series that I've joined on the last 2 episodes. Fantastic, really great. And I also follow along all of your socials and your website. And of course, I listen to podcasts with Dr. Wheatley Price. I have to say, having had some comms experience in my background, phenomenal communications, very polished, extremely well delivered and executed. And I can see the strategy behind it all. So whoever's on your comms team, shout out to them.
You're a small but mighty force.
I think I talked to a couple of them the other day. So but they deserve that shout out. But there's seriously, no joking, there's such a wealth of not just information and resources, but credible information, which I think in this day and age is really important on any of those resources that I just mentioned. And I told you I love that blog, so keep the blog coming.
No worries.
So for our listeners, if you want to learn more about Lung Cancer Awareness Month, which we are heading into, lots of great activities going on. And if you want to learn more about the impressive work that that Lung Cancer Canada and team is, doing, really, really great work, check out lungcancercanada.ca and follow along on their socials. So look, You too, Braz. Michela. I know you're super busy. Really appreciate you making the time and to share, this truly incredible work that's being done, not only by, you yourselves, but all the teams across the country to advance care and equity and, leadership in lung cancer in Canada. So as I think one of you have said, although we've come a long way, there's still much work to be done. And we are grateful for you on behalf of Canadian patients and caregivers and healthcare professionals and the public. We are grateful for you and your team who are really leading the path towards this change for patients. So keep it up, and I'm cheering you on. We're all cheering you on.